Hello everyone, I'm Pouliopoulos from Columbia University, and today I'm going to talk to you about our neuronavigation-guided clinical ultrasound system for blood-brain barrier opening and its preclinical evaluation in non-human primates. So the blood-brain barrier blocks most of the drugs we have developed for brain diseases. The only method that can currently achieve both non-invasive and targeted opening of this barrier is the use of focused ultrasound and microbubbles. This technique has been tested throughout the last 2 decades in multiple animal models and is in humans. In our lab, building upon previous work, we have developed a neuronavigation-guided clinical FUS system prototype. You can see here on the left. The two main elements of this system is a 0.25 MHz transducer, which has an ROC of 110 millimeters and the focal volume of 6 by 6 by 49 millimeters cubed. And this transducer is guided by the BrainSight system on the left, which is a neuronavigation system equipped with the MRI of each patient. And we can do a real-time targeting using this position sensor on the right. Now, we have tested this system on the benchtop. Here on the right, you can see the operations induced by a human skull on the beam. On the left side, you see here the beam in free field, and on the right, after the human skull fragment is introduced. And as you can see here, the focal volume change in terms of volume is around 3 to 4%. And in terms of focal shift, laterally, we have a 0.5 millimeters focal shift and actually around 2 millimeters on average. So it's not that significant. Now, we can also detect cavitation in real time through the human skull using the PCD we have equipped our system with. Here on the bottom, you see in free field at control and bubble situation. And through the human skull, you see the bubble signal rising above the control signal, which means that we can actually detect bubble emissions through the human skull. But does it work in vivo? We have tested this device in vivo using non-human primates after adapting it to non-human primate setup. Here on the left, we used 4 non-human primates for this study. The first 2 were treated bilaterally. The left side was treated with low pressure, 200 kilopascal, and the right side was treated with 400 kilopascal. And these monkeys were sacrificed on day 2 and day 18 after treatment to look into acute and chronic histological effects. And the last 2 monkeys, 3 and 4, were treated unilaterally on the left hemisphere, one with 200 kilopascal, one with 400 kilopascal. And these 2 monkeys were behavioral tested for 3 weeks before and 3 weeks after FUS on a daily basis. Now, going to the results, here on the left, non-human primate 3 was treated unilaterally with 0.4 MI or 200 kilopascal. And so here the BBB opening is well constrained within the treated area of the prefrontal cortex along all dimensions. In terms of volume, BBB opening volume was around 600 millimeter cubed at the low pressure and around double that at the high pressure. The BBB came back to normal within 3 days at the low pressure and was about 40% open at the high pressure. And in terms of safety, we looked into the T2-weighted and T2-weighted imaging at day 0, right after the opening, at day 1 and day 3. And we could see no sign of edema or hemorrhage at either time point, meaning that these treatments were quite safe. We could also do real-time treatment monitoring using the PCD. You see here on the top panel, the low pressure regime, where the bubbles emitted harmonic emissions on a recurrent manner throughout the treatment, whereas in the high pressure regime, we would see a lot of broadband emissions, which are indicative of inertial cavitation and bubble destruction. But we could see both sides with this system. Now, what did NHP brain histology show at the acute and chronic time points? I will talk about 2 main points. First, immune response. We could see a lot of microglia and macrophages flooding in towards the compromised vessels you see here on the left. And microglia accumulated at a high density around these vessels. And this response was resolved by day 18. So it was an acute response. At the same time, we could see some double cortin positive cells, which are progenitor cells indicative of neurogenesis. And this was enhanced within the treated area at both pressures. But both responses went back down to normal to baseline within 18 days. So this is an acute response. Now, is there a change in cognitive function? We tested this hypothesis with a visual motor task. The monkeys had this task within their cage, and it was on a tablet. They had to choose between two images with different implicit values. And we saw that, on average, monkeys improved their accuracy after BBB opening, both at the low pressure and high pressure, and it was way more significant in the high pressure regime. And at the same time, we saw a reduction in reaction time, which means that monkeys performed better and faster on average after treatment. To conclude, BBB opening could be achieved in non-human primates using this prototype system at FDA-approved parameters. We saw macroglia migrating towards the vessels at acute stage, but this behavior was eliminated by 18 days after FUS at the chronic stage. We also saw some FUS-induced neurogenesis enhancement within the treated volumes. And finally, these treatments not only did not compromise cognitive function, but also improved accuracy and reaction time in complex tasks. I would like to thank my collaborators, the Foundation for its continued support in our work, and NIH, and all of you for your attention. Thank you.